we have this AI revolution, which creates these enormously new, better cognitive artifacts. And how can we deploy that in various ways to get drug discovery superpowered?
AI helped us define the shape of the lock, but now AI is helping us define the shape of the key. And once we find out how to make the key, there will be a whole universe of materials. I'm not even just talking about drugs, a whole universe of materials that can interface with biology.
So, ladies and gentlemen, locks and keys, and the two gentlemen who were just behind me on video. I'm David Ignatius, a foreign affairs columnist for the Washington Post, interloping as a would-be AI discussant. I'm joined by Reid Hoffman, the founder of LinkedIn, which I'm sure everyone here knows and uses, Sun Valley investor, and the world-renowned cancer scientist, Siddhartha Mukherjee. They're the co-founders, in addition to everything else they've done, of a new company called Manas AI, which is in the business of drug discovery, and you're going to learn a lot more now about how they're doing it. Reid, let me begin with you. You were an early investor in OpenAI. They're at the liftoff of this amazing revolution.
Yep.
And you're also a board member at Microsoft. Your Manas AI website speaks about your mission of disrupting drug discovery. And I want to ask you, as someone who's a veteran of disruption, what about the drug industry is ripe for the disruption, and how does Manas plan to go about it?
So, look, ultimately, all industries go through periods of disruption. One of the key things that we are seeing with AI is the ability to apply massive scale compute with data, and obviously everyone's familiar with large language models and what's been happening there. But there's actually a whole bunch of different kinds of AI work that is in that prediction about what options are in very complicated spaces. So probably most people in the room are familiar with kind of AlphaGo, which has more moves in it than there are atoms in the universe, and yet you created an AI, AlphaGo, that could beat the world players, and now AlphaZero and its descendants are essentially unbeatable. And that's all through different forms of learning mechanisms that give you prediction. Now in large language models, those are predictions of next token, like what would likely be the next token. And token is you can say word. It's not it's not quite a word. It's actually more kind of a subword is a structure within LLMs. But that also, of course, applies to biology, and that applies to anything from identifying targets that could be the result for targeting a therapeutic. It could be the therapeutic molecule itself. And so part of how this came about is I was sitting talking to my partners at Greylock, and I said, look, there's going to be a ton of very interesting kind of work in the Valley on enterprise software, on productivity software, on security, on coding agents. I'll help with all of that. But I really think there's some blind spots. And part of the blind spots are things, for example, like drug discovery. And they said, okay, that's cool. Well, let us know what you do. And so I started calling, my friends. My very first call was to Sid. Sid and I went out to a Japanese place here in New York, and his selection. Sid has excellent restaurant selections, and
okay,
that's my other
where'd you go?
It was in the village. I forget the name, but it only serves a particular brand from a particular place of Wagyu beef.
Yes.
Is all I remember.
Yes.
Anyway.
And so I was running through all of this stuff and said, well, in addition to being a world celebrated, these are not his words, my words, celebrated cancer researcher, these are his words, the next words are his, I've also brought cancer drugs to market. And I was like, no, I was familiar with the Emperor, and I was familiar with your drug research. I was not familiar with that. And he's like, and so Sid gave me an education on how the current pharmaceutical drug discovery process works. And I went, okay. And we took it down to micro slices and said, okay, here's an area where current AI can do something that's off the shelf. Here's where you could build something. And then we looked at it and said, okay, how do you change that entire process, right? And we said we should do a company. We should make this happen.
So, Siddhartha, I want to turn to you for your piece of this. I'm sure most of us have read your book, Emperor of All Maladies, which is just an extraordinary book, won the Pulitzer Prize in 2011, I think.
And coming out again in December with 5 new chapters.
Good. So I want to ask you, from your perspective as somebody
You can kill someone with it.
thinking deeply about cancer and disease, as you look at this drug discovery challenge that you and Reid have taken on, what do you see in terms of the specific things we worry about as people who are going to get sick? What are the things that you're going to begin to address in terms that this audience, the people watching on TV, would understand?
Well, unfortunately, at some point of time, all of us, and I'm not trying to be a downer, but all of us or all of our loved ones will get sick with something. In the United States, most likely a chronic disease, cancer, heart disease, neurodegenerative disease, autoimmune diseases, and so forth. So what we want to do is to, as Reid said, dissect the process by which the current pharmaceutical channels work in order to make medicines, and make as much of that AI native as possible. Now, obviously, every chain of that can't be made AI native yet, but there are many, many chains that can be made AI native. And I'll just walk you very quickly through them, because that'll give you a sense of the roadmap of where the problems lie and how they can be solved. So almost always, current drug discovery, I'm going to leave aside serendipity, because that's a completely different universe. It will always continue to happen. And to some extent, you can make serendipity AI native. But I'm just going to leave that aside for a second. Well, drug discovery begins with target identification, which means that you figure out what's wrong, what is the cause. Sometimes you can, and not always, but you can sometimes boil it down to 1 to 2 to 3 molecules. Sometimes it's just 1 molecule. Often it's 2 to 3 molecules, and you have to intervene on them. So target identification depends on the corpus of knowledge, and that is very amenable to becoming AI native, because AI is very good at taking vast corpuses or corpi of knowledge and making them AI native. And we can talk a little bit about how it does that. The next thing that happens, by the way, and this is an extraordinarily tedious process, often people ignore false positives and false negatives in that process. AI doesn't ignore that. That's one reason to do it, so you get better drugs at the end. The second thing that happens, and I'll run as quickly as I can through all of this. The second thing that happens is, right now, the most common way, although not the only way, is to either do rational drug design, which means that a computational or synthetic chemist sits down with your target, your protein of interest, and tries to make a medicine that will either block it or activate it, depending on which direction you want to go at. That's rational drug design. The other way is to throw hundreds of millions of candidate compounds onto your protein, have some mechanism to check whether it's being blocked or activated, and then figure out sort of what's called a hit. Both those processes can be made AI native. And so if you make those AI native, you are taking away the chance that you'll get a hit by chance, and taking away hundreds of thousands of hours, human hours, to get that hit. If you make the design process AI native, again, you're not only taking away hundreds of thousands of human hours, but you're also taking an incredible expert, someone who has spent their lifetime learning how to design a drug and converting them into a reproducible and scalable unit.
Let me add in one thing here, because I think I was on this learning journey from Sid, and one of the key things is not just what do you do with the molecule that's killing you?
Yes.
And bind to it. But you have to create something that doesn't bind to other things.
Yes.
That will then kill you. The toxicity is part of where the computation gets actually very
extraordinarily interesting.
Yes.
Yeah, and yeah, go ahead. And then just to finish up the last piece of this, there's a refinement process that's called hit to lead. That's when you take a kind of a proto molecule and then redesign it to go into becoming a real drug. That process can become AI native because there are genetic algorithms that will very rapidly move you to a lead. And the final piece is a clinical trial. That can become AI native too, because many aspects of that trial, including many things we can talk about, shall and can become AI native. So basically, when we went through this dissection process, we quickly realized that each piece of this could become AI native.
So your literature about the company focuses on something you call Project Cosmos. And I want to ask each of you to explain what that is, because talking before we came out here, it's obviously central to what you're going to be able to do. Reid, let me ask you to go first and describe it, really in AI terms, and then Siddhartha, if you speak more about the drug design part.
So, one of the things that casual watchers of the AI, and this gets back to the reason I was setting this up with the discussion with my partners Greylock, is they say, oh, you're just building one big compute model, and the big compute model, you put in tokens and it outputs tokens. And ultimately, by the way, when you're saying, hey, these are targets and these are potential, potential targets, these are potential binding molecules, those are also tokenized. But unlike LLMs, which are mostly these kind of very particular kind of transformers, and this will actually, I think, happen not just with drug discovery, but as with many forms of AI, you're going to actually have multiple types of computational artifacts. So part of what we looked at is said, look, there's some places where these transformers would be useful, but there's also other places where, for example, you want to take a different approach because you want to have the AI, call it agent, if you will, but artifact, obey the laws of chemistry, obey the laws of physics, obey the laws of biology within the set of how you're building out both an understanding of the targets and also prospective molecules that can be cures. And what you want to do is you want to put those together. And part of the reason why you're constructing a new technology, it isn't just like take ChatGPT and say, oh, can you help me figure out a target molecule for triple-negative breast cancer? It doesn't work, right? That's not the way it works. No, you actually build specific, different kinds of AI that work together in order to take this enormously complicated space of biology. Like another thing that some AI people will say is, oh, we'll just simulate all biology. Let's not wait for that. That will take quite some time. And by the way, can you get there fully is an interesting, kind of future question. But so it's building those, and that's what Cosmos is.
So, Siddhartha, we were talking earlier about this, and you came up with a to me, powerful analogy to boxes and things that would fit into boxes as a way of explaining this. Maybe you'd share that with the audience.
Yes, I'm happy to share that with the audience. It'll take a little bit of patience, but stay with me. So first of all, what is Project Cosmos? Cosmos, fundamentally, and we often make this distinction, Cosmos is an attempt to build a true foundation model, a neurosymbolic foundation model to make new molecules, to do generative chemistry. And generative chemistry is different because it's not searching through chemical space. It's not a search function. So you don't take a massive library, imagine you're solving a puzzle, and there's a missing puzzle piece. What it's not is a search function. So one way you could solve the puzzle is you could take all the pieces, which may be 10 billion pieces, and say what fits. And it doesn't fit, throw it away. Fit, throw it away, fit, throw it away. That is not what Project Cosmos is. What Project Cosmos is a generative model, which means that you look at the piece of the puzzle and you say, can I design a molecule that will fit into that piece of the puzzle and thereby make a new drug, but it's completely new matter. It does not exist in the library. It may have fragments that exist in the library, but it's putting together those fragments until you find the puzzle fit. So that's the simple explanation of the difference between generative foundational neurosymbolic AI versus a search and find function, which is a different kind of way of finding drugs. We're actually doing both, but our hopes are we can do the second. Now, I'll just very quickly summarize this box piece. The way to think about this box piece is, now you could ask the question, okay, well, that's great. You said some fancy things. How do you actually make a molecule that will fit inside a particular place? And the way you do this, and no one has ever attempted to do this, is to figure out what the parameters are of that space. So to take that space, which is inside a protein, a hole, literally a hole, a physical hole, but that physical hole has chemical properties. There are some places that are sticky. There are some places that are curved. There are some places that are, as you can imagine from this room, there's a pillar in the middle of it. So imagine now for a second that that entire thing is parametrized. And it becomes abstracted into parameters. And now imagine that your molecule is also parametrized. It just now has a series of properties. So what Project Cosmos is essentially to match, based on learning, match parameters of the molecule to the parameters of the space. And when there's a match, it scores highly, and then you keep building that way. Now, this is a simplistic analogy, and obviously there's much more to this.
This is super powerful stuff. I need to ask the ordinary person's basic question, Reid. How far off is this? How far off is the realization of the dream that you and Siddhartha are describing?
Well, this is one of the things, another thing I've learned from Sid, because part of in a regulatory agency we're not allowed to be very explicit. What I would say is the same kind of amplification that you see in consumer or work use of AI, those are the same tools that we're using to be able to do, so call it fitting the puzzle pieces into the box. And so we're very hopeful about our ability to become a drug factory through software.
If you're being that careful, this must be for real. That's all I can take away. So let me just stay on this, since you mentioned regulatory concerns. I wonder if, as you look at what's happening to the world of public health, as you look at what's happening to the CDC, the NIH, whether you have concerns about the larger framework into which this extraordinary set of discoveries is going to be placed, and the constraints that might be imposed, the privacy issues that might arise. Just to talk a little bit. We're living in a world in which our sense of science and health is being turned on its head, frankly. What do you both think about that?
Well, look, public health is a really different concern. We are concerned about public health. For instance, it would be wonderful to have a new drug against multi-drug resistant TB. And sure enough, it's an amenable problem. The CDC is also a different concern. What we're really concerned about right now is the FDA. And to be fair, the FDA, aside from radical cuts in its staff, which is a big problem, but to be fair, the FDA has sort of kept on its road. It has slowed down, but it's kept on its road. The real harm has been done to, for instance, USAID, to PEPFAR, to the CDC, all of which we know about. The FDA, because there is ultimately, I suppose, because there's bipartisan support, because everyone gets sick, whether you fall on whichever side of the political spectrum you fall on, everyone gets sick. The FDA has been, I shouldn't say left alone, because there have been radical cuts in it, but its path has not been deviated fundamentally. And I'm hopeful, very cautiously hopeful, that the FDA's path will not be deviated, and in fact, some of the cuts will be taken back so that the staffing can come back.
So, Reid, trying to make this non-political, you've
it's a nice
prospered in this amazing American ecosystem of innovation. And a part of that ecosystem historically has been government investment in science and research, in university research, and the incredible laboratories that where scientists work and then often start their own companies. What are your concerns about whether we're damaging that fundamental research engine in the United States because of significant changes in government funding?
Well, I mean, we're making massive impacts, and unfortunately, these are long-term and systemic. I mean, I think there's a lot of, I mean, part of what we had is, and have, but has been very damaged, has been the best scientific, universities in the world, and they are a treasure. It doesn't mean that there aren't things that can be improved, but when you essentially throw all these labs are just like organizations. They have to have budgets, they have students, they have other things, and when you throw that all into deep uncertainty, you essentially massively slow down their ability to function, right? Even as some smart people continue to work there. And obviously the impact on this will be felt in many future generations just from what's happened, in this, first, 8 months so far. And so I think it's a serious self-harm to us and also to the progress of science.
So thank you for that. So, Siddhartha, we have 2 minutes left, my little clock says. The average person's question, I want to posit, when they think about this new world of health and drug discovery is, what about me? How old am I going to live? I mean, so it happens that, as I mentioned to you, my father is 105 years old, which is pretty great. So what I asked Siddhartha was, 20 or 50 years from now, will we speak of somebody who's 105 as middle-aged?
Well, so I think it's very important to distinguish between 105 as middle-aged versus 105 as a healthy middle age, or as what one might call a dignified middle age. Right now, people who are living to 105 are living, I would say, lives that are on the edge. It's like every day is a new day. And that's the reality of what happens. They are dying of diseases like osteoporosis, failure of blood. Actually, interestingly, most of them don't die of cancer and heart disease. Most of those people have been culled away from the population because of medical reasons. So they die actually usually of diseases like sepsis and stem cell failure. They're disease of regenerative failure. We will hopefully, once we've, again, hopefully attacked the frontline diseases, neurodegenerative diseases, cardiovascular diseases, and cancer, and some other chronic diseases, we will move our attention, we already have started moving our attention to these diseases of regenerative failure, osteoporosis, sepsis, immune dysfunction, et cetera, which is what the people who are at 105, et cetera, are dying of. And when we do that, then they will hopefully be living healthy, dignified, what you call middle age.
So this is some of the most intellectually interesting and exciting research that I know about. I just want to thank, on behalf of everybody, Reid and Siddhartha for joining us and telling us about their company. Thank you very much.
Pleasure.